And of course, another controversy. Two rival unions of Kenyan nurses have clashed, with each accusing the other of being fake. The National Nurses Association of Kenya and the Kenya National Union of Nurses are now accusing each other of being used to cripple the county health services through health worker strikes. Fatma Pole has the details.
The underlying currents in the ongoing health workers' crisis in the counties have come to the surface. First, with union leaders clashing over who are the rightful members and which is the rightful union. Leadership wrangles have rocked the unions, with the National Nurses Association of Kenya blowing the whistle over the withdrawal of 2.85 million shillings from the association's main account. They are pointing accusing fingers at their rivals, the Kenya National Union of Nurses, for allegedly trying to change officials of the Nurses Association.
So once you call a strike and it is illegal, your nurses are going to be sacked. I have members we are trying to sort out at Pumwani. They have not been paid since January because they went on an illegal strike. And this is what I'm saying. And when I support the Council of Governors, there is somebody who is instigating these strikes. They are not legal. We have been calling strikes in the normal way, and we know how to call a strike. We know when to negotiate. We know how to respect court orders. But the situation where we find that people are being told, kaeni ngumu, kaeni nje, then people must ask, who is this driving this issue?
There are wrangles in the leadership of nurses organizations. And this one we have to put on notice all the registrars. We put on notice the registrar of trade unions, and we put on notice the registrar of the societies to stop interfering with the nurses organizations.
But this battle for control of the nurses unions appears to be getting more intense.
The other imposter, Mr. Maina, took us to court through a judicial review of 144/2015, which was dismissed because the judge described it as a conman. So actually, the person you had dealt with at the complex was just one of our members whom we had lodged to use the facility today. But he has no capacity to declare himself as the chairman of the National Nurses Association of Kenya.
With the wave of health workers' strikes, many Kenyans have had to seek treatment in private hospitals. And as the crisis in Kenya's health sector keeps growing, Bomet Governor Isaac Ruto gave his 2 cents on the ongoing health issues bedeviling the sector. And when it came to the issue of cancer treatment, the former Council of Governors chairman was quick and sharp.
Kenyatta National Hospital sasa wamekwama. Na ni moja tu, mimi niko na 140, Mashari yako na moja. Na hiyo yake haifanyi kazi, ati watu waende private. Na juzi alikuwa anatupatia lectures. What is wrong with him?
Ruto took a jab at the Cabinet Secretary for Health, James Macharia, accusing him of failing to ensure that the radiotherapy machines were fixed in time.
The only 2 machines existing for oncology. Sasa imeharibika. And na ile equipment alikuwa anasema kuna mingi zingine aweka hapo. Tayari aweke. Can he install one meanwhile? So we are still waiting ajatuletea. One of those ones ile ilikuwa nakuja aweke hapo watu waendelee kutibiwa.
This is the 5th day since radiotherapy services were suspended at the Kenyatta National Hospital, leaving hundreds of cancer patients stranded. Ruto has praised the counties for what he termed as turning around the health sector, but at the same time accused unions and individuals in the national government for hindering that progress. Fatma Pole, KTN News.